Hi, my name is Kristy Wyngowski. I'm from Niskayuna, New York, or Albany, New York. I graduated in 2016. Um, I'm currently a pharmacist at a small community hospital. It's called Ellis Hospital. And I chose URI for pharmacy because of the 06 program. And my other contender was probably Albany College of Pharmacy, since that's where I'm from. But URI's campus is way better. You get to live in beach houses, and I liked the program a lot more. And you just get a better college experience, and you get a fantastic education at URI.
Yeah, definitely. I'm actually from Narragansett originally, so
Mhm.
I've been hearing about URI, my whole life growing up. Everyone's telling me, you should go to URI. And of course, when I applied to schools, I wanted to leave the state and go other places, but then I realized that I had a good thing here, so I stayed.
Yeah, yeah. I'm like the black sheep in our area now. There's not too many of us that did not go to Albany College of Pharmacy, but there's some.
Yeah. It's definitely a good decision that I made. I don't regret it at all.
Yeah,
Do you have any other degrees or certifications besides your PharmD?
I do not. I mean, I'm immunized certified, but other than that, I do not.
Okay. So what does a typical day look like for you at work?
So that's what's kind of exciting about my job now is every day is a little bit different. So today at work, I was in the IV room all day. Um, so I made IVs all day. And other days we'll be in charge of the clinical monitoring for the hospital. So that includes dosing our vancomycin and aminoglycosides. We watch people's platelets levels, try to find some causes and solutions for hypoglycemic events that happen in the hospital. We have a whole like page of things that we monitor, so we go through those. Another role is to verify all of the orders for our ED admissions, and with that comes like if you're our ED pharmacist that day, we fill floor stock requests, so making sure that all of the floors have all of their floor stock products that they need, just like a little side role of the day. Sometimes you're the OR pharmacist, so you're the one in constant communication with our OR, making sure that they have everything that they need. Um, and then, yeah, those are the main things that we do. Sometimes we have to cover for our infusion pharmacist if she goes on vacation or has a day off or calls out sick because she had a side effect from her COVID vaccine. Um, so we'll make the infusions for the day and enter the infusion orders for the next day. So there's a lot of different roles that you can take, and they change daily. Another current temporary role that we have is someone is over at our vaccine clinic right now, making sure that the appropriate number of doses are thawed and drawn up, and assisting our nurses with questions that they might have about previous side effects or people's allergies, and making sure that everyone receiving the immunization is doing okay over there.
Nice. Awesome. Um, so I know you started in community, if I'm correct.
I did.
Did okay. Did you want to talk a little bit about like your experience with community and maybe what changed when you went from community to hospital?
So I started in community actually in high school. I was like a clerk when I wasn't sure if I wanted to do pharmacy or not. I worked at a grocery store pharmacy called Hannaford. I don't think that's in Rhode Island. Um, and I worked there the end of my high school, all through college. And then when I graduated, I ended up getting a job with Rite Aid, and I really liked it. I loved working 12-hour days because you worked less days per week. And with my schedule, every other weekend was a 3-day weekend, but I liked being the person that people in the community could come to and they could ask questions. We had so many patients that would come to us before they came to their doctors, and you help them when you can, but um, obviously sometimes we still would send them to the doctor. But the trust that I worked in two great communities. I had two stores that I managed. I had great communities that I worked with. One of them, the pharmacy closed when Rite Aid got purchased by Walgreens, and they were so devastated, and everyone would share stories about how like the pharmacy had an effect on them, which is something that you really don't realize because they leave and you move on to the next person. But hearing how you make an impact was really nice. So a lot more patient interaction in retail than I obviously see in the hospital. I really don't. I mean, I know our patients, like we have some frequent flyers, just like you do in community. Um, you have some pleasant ones, you have some more difficult ones to deal with, but you don't know them like personally. You don't know about their grandkids or their where people are going to college. You just know that they're kind of there. So I miss the patient interaction a little bit, but when I switched to hospital, I felt like I got to use a lot more of my knowledge that I learned in school. Retail, a lot of my day was fighting with insurance companies, and you see a lot of the same medications over and over. So I see a lot of different things that I did not see in retail, which I really like. And I'm very lucky. Our hospital actually has an outpatient pharmacy in it. So I fill in there when one of their outpatient pharmacists needs a day off or goes on vacation. So I still get my little fill of patient interaction, which is nice.
Yeah, that's cool. So you kind of have the best of both worlds. You have like the patient interaction here and there, and then you get to do
Yeah.
clinical stuff. So,
And we have a couple positions in our ER that, like, we've got a pharmacist in our ER. So she sees patients, she does med recs. And we have a patient or a pharmacist on one of our like cardiac floors dealing with discharges. So I don't know if you've learned this yet, but if a patient gets readmitted within a certain time frame for certain conditions, Medicare won't reimburse them. So it's one of our goals to prevent that from happening. So we have a pharmacist up there making sure everyone is set up with their medications, prior auths have gone through, like they just can go home and take care of themselves and try to decrease readmissions so we get paid.
yeah, that's definitely an important part of hospital pharmacy, I feel, is the transitions of care portion of it.
Yes. So even though, and there's so many opportunities in hospital now that weren't there. I did a rotation actually at the hospital that I work at now, and the number of opportunities that have come up like that have grown a lot. Our pharmacist who does discharges, that was basically my rotation. Me and another student, it was the first time they had tried it. We started rounding every day with the doctors. We started working with their discharge patients, and they saw such value in it that they continued to ask for the APPE students to join them on rounds. And they really saw such value in it that the doctor who runs rounds pretty much proved his point that it was worth it. And now they've got a full-time pharmacist up there. So that was really cool to see from when I did my rotation there in 2015. 5 years later, when I started working there in 2020, it became a thing.
Yeah, you were one of the first in the
Yeah.
whole thing.
Yeah. Little old me, I didn't know then.
Yeah, right. That's awesome. What do you feel like is the most difficult part of your job right now?
That's hard. Right now, I just feel like we're getting stretched very, very, very thin. When the pandemic started in April, our census was very low. So we had a lot of time to commit to our COVID patients. But right now, our census is high and our COVID numbers are high. They've started to drop in the last few weeks, but they've been high. And now we have a vaccine clinic on top of it. And people don't like to wait for their vaccines. So we just keep getting spread more and more thin. But our department's great. We keep rising to the occasion and doing it. But I think the time management and prioritizing importance of where do we direct the resources that we have right now is really, really hard. And that was always hard for me in retail as well. But patients weren't critical. Like someone wasn't going to die if they had to wait 20 minutes for their flu shot, where like someone might die if they have to wait 20 minutes for that IV to get made and get run up there. So that was probably the hardest part, I would say, at this time.
Yeah, definitely. I feel like there definitely is a difference in urgency working in community compared to inpatient. And I definitely saw that when I was on rotations inpatient, because I work in community and I've worked only in community for 4 years. So seeing that was like, okay, this is different. It's it's
a different kind of urgency, right? So in retail, the urgency was like, gotta hurry up so my metrics are good, gotta hurry up so I don't get yelled at, like, gotta hurry up because there's a sick kid in the car. and
Right.
we want to get them and their mom home.
Right.
Whereas now in hospital, it's like, oh, we got to hurry up because they're coding.
Right. Yeah. So, I mean, do you want to talk a little bit about codes and how you respond to them, and if you know, what your role is in that?
Yeah, so I personally don't respond to codes at this time. We have a pharmacist in our ICU Monday through Friday. So if there's a code in the ICU, our pharmacist will go and assist. The pharmacists up there are ACLS, BLS, what's the right one? Ian Lester has to fix that.
I think ACLS. I don't know.
Our pharmacists up there can help on codes. They can do compressions and assist with CPR because the code goes on for a long time. Compressions are exhausting. They need help. But their big role is like the constant communication with the pharmacy and what orders they need enter stat, what drips they might need stat. That's their main role, but they are also trained to help with compressions. Same thing in our emergency room. All of our pharmacists there are trained and able to help on codes. And the constant communication with us to make sure we get the patient what they need. At the moment, epinephrine syringes, like we are on back order. Normally code carts have like 10 syringes in each cart, and right now they don't. They have 2, which buys us about 10 minutes. And we've got like little epinephrine mini bags that we make. And so if we hear a code blue called, one of our techs, you'll just see them like they start running with the bag. And so our techs are responding to codes, but they basically have to like sprint there, give them the bag, run downstairs and get another bag and put it in their Pyxis in case they need more. But normally they've got like 10 syringes and they're good to go. So our techs are an extra person right now.
Gotcha.
That's kind of how they go in our hospital.
Nice. So, how do you feel like URI prepared you for this role?
I think so. You're going to get your clinical knowledge wherever you go, in my opinion. But it's like how you retain it, how they teach it. I feel like I work with a lot of people from Albany College of Pharmacy. I actually live in the same neighborhood as 2 professors that teach at Albany College of Pharmacy. So I've talked about the differences in curriculum a lot. And Albany College of Pharmacy, they have all of their professors that teach them, which we do too. But when we're learning like the pathophysiology of something, we have a lot of experts from Brown come in or different hospitals. And that's just something that I didn't appreciate as much while I was in school as I do now looking back, because all those doctors have like the most fascinating and unique stories that they're able to share with you. And it's those stories that make you remember the things and bring it home and remember it and use it in practice instead of like, you know, no offense, Dr. S's, but Dr. S is telling you the same thing over and over is like a little different than a weird, unique story, although she has some good stories.
Yeah, that's true. I feel like I also didn't appreciate the value of that because, I mean, thinking about it, like I feel like we had a different doctor come in every week almost.
Yeah. And it made it hard because you're like, oh, they're test questions. We don't know what to expect from their test questions because that's what you're thinking of. But now looking back, I still remember some of their stories, and I graduated 5 years ago.
Yeah. Yep, exactly. So definitely something unique about URI.
But yeah, and I think URI, they just create incredibly well-rounded students when they graduate. One of my district managers when I was in retail, he has all of his Albany College of Pharmacy people, but he had me and a girl who graduated 1 year before me. And he said, there's just something about URI grads that are different. And he couldn't put his finger on it, but I was like, yeah, like, you're right, we're better. But so that was nice to hear. And it was a good feeling, and it made us proud of our school.
Yeah, that's great to hear. And I do feel like we hear that a lot, or at least I do when I'm, you know, on rotation or talking to people that don't know anything about pharmacy even, and they say that URI grads, pharmacy grads are just, they're different in a way. I don't know why.
Yeah. Our professionalism too, because now I see Albany College of Pharmacy students come through. I feel like I'm crapping on them. I'm not. It's just my comparison. The professionalism that you see from URI students is fantastic. they're dressed appropriately, they act appropriately, but they're also not robots at the same time. They can have genuine, meaningful, good conversations, um, appropriate conversations. They ask good questions, but they don't ask zero questions. It's just the right balance.
Yep, they got a good program over there.
Yeah.
How do you see your role as a hospital pharmacist? How do you see that evolving in the future?
So that was something I talked about in my job interview there is, I was like, I'm not the person that's going to be stuck in the basement forever. That's just not me. So my current manager, the one who's been running the vaccine clinic, he's supposed to have a baby. Well, his wife's supposed to have a baby on Thursday. So they've made me in charge of our vaccine clinic now and making sure that we've got the right number of doses over there. We've always got a pharmacist there to help them. So that's been a nice role that I've been able to step into. And they picked me because they said my retail experience has taught me to handle chaos very well, which is very, very true. So I'm glad I was able to step in and fill that role, and it's been going really well so far. We vaccinated over 7,000 people in 6 weeks. So that's been pretty good on top of everything else we get to do. And we've got an antibiotic stewardship pharmacist, the roles in the emergency room. Eventually, I might like to get up to a floor. Hopefully, once the pandemic comes down, we have a role for pharmacists on one of our cardio floors. So who knows, maybe I'll end up there. But our hospital is recognizing the worth of pharmacists as we create more of these positions, and then they're craving more of them and more of them. So we keep adding positions. And even when hospital numbers are tight, which they are right now, COVID's costing us a lot of money, they're still adding more pharmacists and more positions. So I don't know where it's going to lead me, but somewhere different, somewhere good.
Definitely. I know. And that's cool to think that our profession does have so many different avenues, and
Yeah.
you can make a decision to make a change at some point. So,
Yeah. It's a scary change, but
yeah,
it's a good change.
definitely. So those were all the questions that I had prepared. Was there anything that you wanted to add that we didn't talk about or anything?
I don't think so. This is for prospective students, right?
Yeah.
There's so many choices. In my whole career at URI, I thought I was going to be a retail pharmacist. And now I'm not. And I'm still really happy. And I get more time with my family. My big drive for a change was I had a son, and 2 12-hour days in a row for me. They were just, it was too much time away from him. I didn't like it. So I got out, and now I'm home for dinner every night and every 2 out of 3 weekends instead of 1 out of every 2 weekends. So I would say don't limit yourself, because take like whatever elective you think is interesting, not necessarily the one that fits best in your schedule, and try lots of things. Do hard, unique rotations, because you never know where it'll lead.
Yeah, for sure. I'm definitely keeping that in mind as I finish up my P4 year. But that's all really, really helpful. And I think this prospective students are going to appreciate what you shared with us.